Welcome to the NEJM Outbreaks Update. I'm Stephen Morrissey, Executive Managing Editor of the journal, and I'm here with Eric Rubin, Editor-in-Chief, and Lindsey Baden, Deputy Editor. Today we're joined by two people who are deeply involved in their state's responses to H5N1 influenza. Jennifer Shuford is the Commissioner of the Texas Department of State Health Services and previously served as the Chief State Epidemiologist of Texas. Robbie Goldstein is the Commissioner of Public Health for the Commonwealth of Massachusetts. Both Jen and Robbie are infectious disease physicians with a long interest in public health. Eric, before we start with questions for our guests, what did we learn in our last podcast about H5N1?
Well, Steve, we heard that H5N1 is primarily an animal virus. It has long circulated in animal populations, particularly in birds where it's endemic. But recently there's been an outbreak and widespread disease in cattle in the United States. So far, there have been a limited number of human infections here, and most human disease that's occurred in the U.S. has been mild, though there have been a couple of severe cases and one death. The H5N1 that is present in birds in other countries also occasionally transmits to humans, oftentimes, though, with relatively severe disease.
And now let's turn to our guests. Let me ask each of you, starting with Jen, what's the situation in both wildlife and domestic animals in your state?
Thankfully, in Texas, we've had fewer cases of H5N1 in our domestic animals recently. About a year ago, we were the first state to detect H5N1 in dairy cattle and really saw that transmission between animals and between dairy farms. Now, almost a year later, we're seeing fewer herds impacted in Texas, which is fantastic. But because this is a panzootic and migratory birds that have been going on for a couple years, we're still seeing it in wild birds throughout Texas. We've got a major flyway that goes right through the middle of Texas, and migratory birds are on that flyway. And so we continue to detect H5N1, especially in those wild birds, but a lot fewer in our domesticated animals right now.
And Robbie, how about Massachusetts?
Well, here in Massachusetts, we've had highly pathogenic avian influenza, H5N1, since 2022, when our agricultural department first noticed it. And since then, surveillance testing across the state has confirmed that wild birds are certainly infected with H5N1. Fortunately, we too have not seen a lot in our domestic flocks here in Massachusetts, but we are seeing some transmission to other mammals in Massachusetts. We have done a lot around our dairy cattle, specifically to look for the presence of H5N1 here in Massachusetts. Unlike what you heard about in Texas, here in Massachusetts, we do not have any dairy farms with H5N1 present. And we know that for certain because we've been working very closely with our academic partners to test the 95 licensed dairy farms in the state since August 2024. We do monthly genomic testing on the milk that comes from those farms. We make sure that that goes directly to the testing lab and then to the Department of Public Health and the Massachusetts Department of Agricultural Resources. That monthly testing has confirmed month after month that there is no H5N1 on our farms. But I think important to say that here in Massachusetts, we remain really vigilant, and we're really lucky to have colleagues like those in Texas who have experienced this on farms, experienced this in some of their other animals in the state, and we can learn from their experience and make sure that we're putting proactive measures in place.
Can I ask each of you, has the outbreak resulted in changes in policy in handling domestic animals? For example, Robbie, are there imports of dairy cattle from other states right now, or are they more limited?
Yeah, so through this process, I've learned a lot about the migration of cows in America, which is really something you don't learn in medical school, I'll tell you that. It turns out that there's a whole market that brings cows up into the Northeast, and our cows actually are coming from a market that has not had a lot of H5N1. So we've been lucky that our cows that we import into Massachusetts, and I would say more broadly across New England, are at lower risk in general for H5N1. And then we've implemented, in collaboration with the Department of Agricultural Resources and also with the federal government, testing of cows that are migrating into the state either because of sale so that they can go be used in a dairy farm, or because they're coming to our state as they go to slaughter. We are a central location for cow migration for slaughter here in New England. And so we bring a lot of cows in and then get them to the next location.
Jen, Texas is famous for migratory cattle. Are there any restrictions there?
There are policies and procedures in place now to test herds that are planning to move. And so before they can move, they have to have a negative H5N1 test. And that has helped decrease some of that transmission through a movement of cattle. But we too learned a lot about how cattle are moved through the country on a really regular basis. And it caused kind of interesting disease transmission during those first few months when we could really epi-link the H5N1 in dairy cattle in other states back to Texas because of all of the cattle movement that happens all across the United States.
So just to understand this a little bit better, is the transmission among cattle between herds, or is it new introduction from the fowl that are flying around all of us? How important is each mode of transmission in the spread of this?
I think that is one of the most fascinating parts of what we've seen over the last year is when we first identified H5N1 in dairy cattle in Texas in March of 2024, we were seeing transmission between animals and learned that they had really high concentrations of the virus in their mammary tissue and therefore it was being transmitted into the milk. And we could see it move between animals. We could see humans going from farm to farm and potentially spreading it that way. And so we were seeing just this one genotype of H5N1 kind of spread through all of these cattle and across the country. And so that was the B3.13 genotype. And so we were thinking it was from one spillover event that happened probably at the very end of 2023, beginning of 2024, and caused a lot of herds in Texas to be ill before it was finally identified. And that was the genotype that was isolated from cattle all over the country for months until very recently. And recently, there's been D1.1 genotype being identified in a couple of dairy herds. And so now it looks like there's multiple spillover events that have happened just over the last couple of months of this different genotype. And so it's fascinating because I think the first time that we identified H5N1 in cattle was a year ago. And that one genotype was what was transmitted mammal to mammal. But suddenly we're seeing these other spillover events. And certainly some of that is because we're detecting it. We're detecting it in this milk silo study that's happening. And we can find that H5N1 in the milk and trace it back to the dairy and really be able to identify these spillover events. But it's also kind of interesting the pace at which these are happening that we didn't know about before.
Most of the human cases that Eric talked about have resulted from exposure of dairy workers. So starting with you, Robbie, are you recommending any special measures for people who have contact with dairy cattle?
Right now in Massachusetts, we're focusing a lot of our efforts on education of those that work on dairy farms. So making sure they understand how to identify sick animals. They know the pathways to alert agriculture and public health agencies if they notice anything abnormal on the farm, decreased milk production, a sick animal for any reason. But working very closely with agriculture, we recognize that it's actually really hard to wear PPE when you are out on a dairy farm. And it is not routine practice to wear PPE on the dairy farm. And so rather than force the dairy farmers to do something that is going to be very hard to comply with, we've instead heavily leaned on our testing program. If we can test on a monthly basis, if we can make sure that there's no H5N1 present in the state and even broader across New England, we can then reassure ourselves that these folks are going out to the farms and keeping themselves protected. There's always been some level of personal protection that exists on farms, changing clothes as you get to the farm and as you leave the farm. Those things remain in place, but we aren't instituting a new PPE program here in Massachusetts for dairy cattle.
And Jen, what's the situation in Texas?
So we've worked with our Texas Division of Emergency Management and made sure that we have pushed PPE out across the state and so that it's available for dairy farms that would like to have greater access to this PPE. We too know that it's maybe an unrealistic expectation that these dairy farm workers are going to be using all of this PPE. We live in Texas. During the summer months, it's routinely over 100 degrees here. And to put on the amount of garb that's recommended is probably, like I said, unrealistic. And so while we've made it widely available, we're not confident that it's being used widely.
And then what about poultry farms? Are workers there at increased risk, and should they be doing anything special? Jen, start with Texas.
So poultry farm workers are definitely at risk, considering that this is highly pathogenic avian influenza. And so we expect it to be traveling through birds and infecting birds. Interestingly, what we've seen in the human cases in the United States over the last year is that a lot of them have been in the dairy farm workers and not in the poultry workers. And I think poultry workers are used to looking for signs of this illness, and that the workers that depopulate flocks that are infected also are used to this business. There's a lot of contract workers that do this. They know how to use their PPE. They do it very effectively, usually. They're plugged into the public health system so that we can help with that monitoring, so that the system that these workers on affected poultry farms has been well practiced and that they institute it well. And we've seen far fewer infections in humans than we'd expect, considering over 160 million poultry in the United States have been affected. We've seen very few human cases considering that fact.
And Robbie, Massachusetts?
Here in Massachusetts, we have a pretty limited commercial poultry industry. Anyone who's driven across Massachusetts probably could recognize that. But we do actually have a lot of backyard flocks in Massachusetts. And it seems as if backyard flocks are at a little bit lower risk than our commercial flocks, but we still need to raise awareness of those who have backyard flocks to make sure they understand what they can do to protect themselves. Things like keeping their flocks indoors and not letting them, quote, free range, where they might be exposed to wild birds or to the virus. Making sure that folks know how to take care of standing water on their property, which is where birds may congregate and where the virus may amplify. We're also really limiting movement of poultry across the state from backyard flock to backyard flock to try to make sure that we can monitor what's happening. And if there is a sick bird, make sure that it doesn't go to another part of the state. But I think we're a little bit lucky here in Massachusetts that we don't have large poultry farms where this could be a potential risk.
Robbie, you bring up an interesting point. The severe cases that have been seen do come from backyard flocks, and that, I think, mirrors the experience in Asia, where many of the poultry to human infections are in small household flocks of birds. I wonder about the challenge of doing education in this group of non-professional farmers.
It's hard. I will admit that. It's really hard. You don't have, corporation coming down and saying you must wear certain personal protective equipment or you must check the birds at a certain frequency. What we found most helpful is to collaborate with agriculture, but also with our local boards of health. So here in Massachusetts, we have 351 cities and towns, 351 local boards of health. They actually know every backyard that has a flock. They know those individuals. There must be a permit, and it's issued by the local board of health. So we've reached through the local board of health to be able to provide direct information and education to the households that have backyard flocks. And we see it actually working here in Massachusetts. We see people taking that education, changing the practice, making sure they're protecting themselves and protecting their flocks.
Jen, that must be a much more of a challenge in a huge state like Texas.
It is. We certainly don't have that level of visibility on all of the backyard flocks across Texas. And so communicating with the public and especially targeting people that might have those backyard flocks has been really challenging.
I mean, I guess a corollary to that is the sick bird problem and how one identifies that and how the public should be interacting with sick birds.
I'd say they shouldn't. they shouldn't interact with the sick birds. And that's actually the message that we're getting out, which is if you see a sick bird, leave the bird alone and call the authorities so they can come and check on the bird. And we put out some additional guidance there to say if you see 5 birds together that have all deceased or 5 birds together that look sick, it is very likely that that is H5N1. And so please stay away, call authorities right away. But most of us aren't veterinarians. We don't know what to look for. And some of the signs of illness can be subtle.
And in terms of the spread in other species, we've heard of seal die-offs. It affects cats, big cats, small cats. How should we be thinking about our pet cats and other pets around us that may be indoor-outdoor?
Messaging all of this to the public has been really difficult, but we know that these other animals are at risk. We've seen just recently several reports about cats dying after drinking raw milk or eating raw food. And so we know that pets are at risk. Other animals in the environment are at risk, especially animals that might eat a sick or a downed bird. But getting that message out to people to be on the lookout for those ill animals and not to contact them, but instead to contact one of the state agencies to help them with that, as well as communicating to healthcare providers, physicians, that this should be part of their history if they see somebody with influenza. All of that is really hard to message and to really get that message out clearly.
Right now, clinicians are seeing many cases of influenza-like illness. Should they be on the lookout for anything in particular? Robbie, start with you.
I'd start by highlighting something that we've already alluded to here. There's been 160 million domesticated birds that have been infected, almost 1,000 dairy cattle herds infected, millions of wild birds. And despite all of that, there have only been 70 human cases here in the United States. So it's important for folks to remember that the risk to humans here in the US remains low. That said, folks who are coming in with severe presentations of influenza-like illness, anyone coming in with conjunctivitis, really anyone coming in with flu-like illness should have a really good epi-history so that we can understand, is there any potential exposure to H5N1 that would warrant further investigation and also isolation of that individual, protection of the workforce. I can't not mention that we here in Massachusetts and across the country are experiencing a really severe influenza wave this winter. Even though the cases are coming down in Massachusetts, we are still higher than most of our peaks over the past 5 years. We've had 242 deaths in Massachusetts this year. 8 of those are in children. This is a very severe flu illness season. And so it's important for everyone, 1, to get vaccinated, and 2, for physicians and clinicians to be proactive about asking the epihistory, understanding who may be at risk, getting people tested, and getting people on treatment.
And Jen, anything in Texas?
I would say the same thing that Robbie just said, that we are encouraging healthcare providers to take that additional history about exposures to animals, or if they work on farms, to really understand what their possible exposures are. It's difficult as a physician doing an acute care visit to have time to even get into that sort of detail, especially with a limited number of human cases. However, there are times that it would be very helpful for us to get an idea. We know that with influenza testing, that these H5N1 cases are going to pop up as influenza A. And without a little more diving down into the history, or without doing some subtyping, that a lot of these cases could go unidentified, even if we're seeing an uptick in the human population.
How available is testing for H5N1 virus in each of your states?
So I can start with Texas. The healthcare centers, hospitals have the ability to do subtyping on their influenza viruses and to know whether this is just going to be a seasonal flu virus or if it's an influenza A that doesn't otherwise fall into one of those seasonal groups. At which point, we've got multiple public health labs across Texas that can do that additional subtyping and find out if it's a H5 virus, as well as a major state public health lab here in Austin that can do that test. That's a preliminary test. After we identify H5, we do ship that specimen to CDC for confirmatory testing, and they're the ones that confirm it's an H5N1. But that system for testing is strong in Texas, and we're able to do that fairly quickly and then get that confirmatory testing done at CDC.
I'd say it's fairly similar here in Massachusetts. We're lucky to have a large number of academic medical centers that have the ability to do that subtyping and do that subtyping on certain cases that come in. Through the State Public Health Laboratory, which is in Boston, we ask for severe cases of influenza, those that require ICU admission or may have an atypical presentation, those samples to be sent to the State Public Health Laboratory, in addition to a subset of other respiratory samples. And we do routine surveillance to see, is this routine seasonal influenza or is this an H5 influenza? And then we have the same process if we do identify H5, that we would work closely with CDC to send a sample for confirmatory testing as we deal with the public health pieces here in Massachusetts, the isolation, quarantine, and prophylaxis.
Thinking that through, as seasonal influenza season sunsets, hopefully over the next month or two, should the testing strategy be different during the spring and summer when seasonal flu may not be circulating?
Yeah, I'll note here in Massachusetts, we actually have an advisory out that says no matter the season, if you see severe influenza, if you see a respiratory illness requiring ICU admission, send a sample to the state public health lab. But we actually know from history that the number of samples coming in the late spring, early summer months decreases dramatically. So I think it's important for us all to remain vigilant, for us to really encourage folks to send samples to the state lab. We can do that routine surveillance. It's at no charge to the individual or to the institution. And it's the only way that we'll be able to stay vigilant to see if anything is circulating in Massachusetts.
Similar approaches in Texas, Jen?
Yeah, one thing that we were relying on during the summertime was syndromic surveillance and really looking to see if we saw any spikes in influenza-like illness hitting emergency departments across Texas, knowing that that would be unusual outside of flu season. But then when we hit this more severe flu season and we're drowning in oceans of positive flu tests and lots of visits to the emergency department, that syndromic surveillance became less useful to us. And we did rely on really asking hospitals and private physicians to submit samples to our public health labs so that we could do more broad subtyping of those samples. And the other thing that we've added to it, and Robbie, I'm sure y'all are doing this too, is some wastewater surveillance, looking to see if we have any signals throughout Texas of H5N1. We knew when we had a lot more infections in dairy herds that we really saw increased signal of H5N1 in our wastewater across the state. And so looking for that as well is just an additional signal to us that there's some activity going on in our state and that we need to kind of double down on some of our other surveillance to figure out exactly what's going on.
I love the fact that you use the all so that we know that we actually have someone from Texas here.
Thank you.
So, Jen, with the wastewater surveillance, which I think has been a real advance as we try to monitor intrusions of pathogens into our communities, are you able to differentiate wastewater H5N1 from herds and animal reservoirs versus human infection?
No, it has been very complicated. We know that there can be a variety of different introductions into the wastewater that would provide that signal. We are using it to see if we see any evidence of human infections, but knowing that wild birds could be depositing it in some of these wastewater systems, that the dairy herds might be in places where there's not even a sewage treatment plant, and that actually the signal that we're seeing is from the milk processors where that unpasteurized milk has been shipped across the state to a processor. And we're seeing this signal there after they wash out a truck or wash out a tank. And so, no, it does not give us a clear indication of what deposited that H5N1 into the sewer system, what was the animal that did it, and what our public health response should be. We just know that we see increased signal in the wastewater when we're seeing increased activity of H5N1 throughout cattle in our state. And so I trust that it's a good indication to us that something is going on, but how precise it can be and how well it can direct really precise public health actions is still to be determined.
In thinking about control, you mentioned culling of herds and culling of flocks. How well does that work?
Well, here in Massachusetts, it's worked for us. When we have had a backyard flock that we know is infected and we go in with the right resources and the right authorities, we can decrease the risk of that backyard flock spreading the disease to another backyard flock. We have not had to do that for cattle in Massachusetts because we don't have any disease in our cattle farms. We've had to do it for some domesticated poultry flocks that we have. And we've found that it is effective. When these birds get sick, and we know as they start to die off that the disease is going to start to spread, and so we can contain it. I think we've seen that nationally it's had a huge impact, right? We've had to cull a lot of poultry, which has resulted in not only a shortage of poultry, but a shortage of the eggs that the poultry produce. And that has been challenging for the nation, but likely the right thing to do for public health.
And in keeping the public safe, Jen, you sort of mentioned how it's in the mammary tissue of dairy cattle, it gets into the milk. How do we keep the milk safe?
I think the best way to keep the milk safe is through pasteurization. There's been pre-existing data as well as new data showing that pasteurization does inactivate this virus and therefore prevent transmission of disease through these pasteurized milk products. There is still that ongoing concern that there's significant consumption of raw milk that's happening in Texas and across the United States, and that those people would be at risk if those raw milk dairy farms are being impacted by H5N1. So it is something that we are concerned about and that we are trying to do some testing around it to ensure that those raw milk dairies, if they're in areas where we know of other outbreaks occurring, that those dairies aren't selling milk that has H5N1 that can be transmitted to a human.
So as you've said, there have been a fairly limited number of human cases so far. Is there anything that keeps you up at night? Perhaps start with you, Robbie.
I'd say as an infectious disease doctor and a public health practitioner, many things keep me up at night. But when it pertains specifically to H5N1, what I'm most worried about is our ability to communicate about this disease. And I think there have been worries for some time about public health's ability to be trusted, to put out transparent communication that informs the public. And now more than ever, we need that trust. We need that transparency. We need the ability to share our message with folks. And then when they hear the message, to take action. That's true if you are managing a large dairy farm in Texas. And that's true if you are the homeowner in a small town in Massachusetts with a backyard flock that may be at risk. We need people to hear folks like Jen and me and trust what they hear and then take action on what they hear.
And Jen?
There are so many concerns, and Robbie has just hit on one of them for sure that we're experiencing not only with H5N1, but some of our measles outbreak right now too. But I know that reassortment is really the thing that I'm concerned about here. Sure, we've had limited human infections. We haven't identified human-to-human spread. That could change. That could change with just the mutations within the virus, but it could also change with a reassortment event, which we know happens with influenza A. And recently in Oregon, there was a documentation of H5N1 in swine, where there was a setting where pigs and poultry and obviously humans were all together in the same space. And that's exactly the sort of situation where we could see this virus change and change for the worse. It could create another situation where we have a pandemic and our country is not prepared to have another pandemic right now. Our public health workforce isn't prepared for another pandemic. The healthcare workforce isn't prepared, and the public isn't either. We were all really traumatized by the last pandemic, and the thought of another one occurring is really concerning to me and definitely keeps me up at night.
Jen, I can't let you go, even though it is an influenza podcast. It is on the outbreaks page, and there is an outbreak occurring in Texas right now. So I wonder if you could give us an update on where measles stands right now.
Sure. Our measles outbreak here in Texas has been going on since mid-January. We've had a rapid increase in the number of confirmed cases. I know that right now we are over 190 confirmed cases in that period of time of less than 2 months. And so we're seeing a rapid pace of increased confirmed cases. And we know that we are not getting all those people tested who have symptoms out there. There's a lot of people who aren't coming in for testing. There are many more cases than what we're actually identifying. And so really trying to get out that message about vaccines being the tool that have helped us control this in the past. The MMR vaccine is what helped us eliminate measles from the United States, declared in the year 2000. And the MMR vaccine is what's going to help us contain this and keep other outbreaks from happening. But as we talked about, it's a hard time right now. People are still traumatized from the pandemic. There's a lot of questions and uncertainty, distrust of vaccines. And so pushing a really pro-vaccine message is hard. And we're trying to manage that the best ways that we can. But it is a huge challenge for public health. It was before the pandemic, and it certainly is now. And so we're trying to work on that while we try to contain the measles outbreak.
I do want to give us a chance as a group of infectious disease doctors here. And I think Robbie and Jen, you put it well. There are many things that have kept us up at night, but I don't want to end on such a catastrophic note. Do you guys feel like you have the tools right now that can make a big difference in outbreaks like the current influenza situation?
I think we're building those tools. I do think we've learned a lot. It's almost 5 years from the declaration of the COVID-19 public health emergency, and we've learned a tremendous amount over those 5 years about how we respond to pandemics, how we collaborate across medicine, academia, public health. I think that we are putting resources in the right spaces. Here in Massachusetts, we have a really great network that is pushed out through the Pathogen Genomics Center of Excellence, which is CDC funded. It brings together not just Massachusetts, but Connecticut and Rhode Island. And it brings all of us into a space where we can share genomic sequencing. We can understand the impacts of viruses as they start to spread across our states. And then we can share that information with CDC and the rest of the nation. So I think the toolkit is bigger and broader 5 years after COVID-19 came. The question that we all have right now is, what resources are we going to have over the next 4 years to support that toolkit? What don't we know at this moment that might present and may challenge us once again in the way that COVID challenged us? There's a lot of unknown out there. And so it's really hard to definitively say, if a pandemic were to happen again, that we have everything we need in place to respond to that.
I think another of the great things that's happened just during this H5N1 experience that we've been having over the past few years is that I can speak for Texas, have gained an awareness of all the different jurisdictions, all the different agencies that are actually involved with different parts of HPAI and this particular H5N1 experience that we're having right now. For instance, Texas Department of State Health Services is the public health department in Texas, but the Texas Animal Health Commission does public health for animals. Texas Parks and Wildlife is the one that's doing surveillance on the wild animals. And so when we get our data, it's not automatically shared. It's not necessarily posted. And so it's, first of all, understanding how people's different job duties all kind of play a part in this, and then developing relationships where we share information and really work together for the common good, that one health approach. But what we're experiencing on our state level, every other state is experiencing too, and the federal government is. And so USDA plays a part, FDA plays a part, CDC plays a part. And so having to build those relationships has been challenging, the awareness and then the actual building of the relationships. But because this has kind of proceeded slowly from the aspect of spread between mammals, it's given us this runway where we can figure out where everybody's jobs kind of overlap, where the agency jurisdictions overlap, and have given us a chance to build those relationships so that we're better prepared if this H5 situation escalates and becomes more of a human health issue.
Thank you, Jen, and thank you, Robbie, for joining us today.
Yeah, thank you. That was great. That was fantastic.
Thank you for having us.
Yeah, thank you so much for inviting me to be here today.
And thanks, Eric. Thanks, Lindsey.